Hello, our dear viewers. We're back with Health and Fitness, and our guest for tonight, Dr. Abdullah Gholoum, consultant psychiatry. And I also like to remind you that your favorite show, Spotlight Sports, on Sports, is back every Tuesday at 9 p.m. with my colleague Tariq Al-Aryan and directors Abdulaziz Atiyah and Jabir Ahmed and Ahmad Al-Khalifa. We have a phone call from Khalda.
Yes, hello?
Yes,
hello,
Khalda.
yes.
Hello, good evening.
Hello, good evening.
Dr. Abdullah?
Yes.
I would like to ask a question, please.
Go ahead.
Okay, Dr. Abdullah, I would like you to define for me manic depression,
Okay.
especially severe manic depression.
Okay.
And what is the difference between this illness and schizophrenia?
Okay.
Especially that, you just, a minute ago, you talked about schizophrenia.
Yeah.
And I know a person with severe manic depression, which seems to be,
Yes.
alike together.
All right. Are
So-
you a physician yourself?
No.
Okay.
I know somebody with manic depression,
All right.
especially severe manic depression. Yeah.
Okay.
Okay, that's
Okay,
the only
Khalid.
question.
Well, this is, Ahmed, a very big question. Okay, it's a
4-year college.
not exactly, but okay. I respond to Khalid's question. The term manic depression is, sometimes used, but the proper term that we use these days is bipolar disorder. Bipolar disorder. And why we call it bipolar disorder? Because these patients experience two poles while having this illness. At the one end, they experience what we call the manic symptoms, which means elated mood, feeling happy, feeling increased self-esteem, talking too much, not wanting to sleep, spending money, being involved with so many activities. Sometimes patients will drive recklessly, sometimes they will abuse medications, sometimes even their sexual activity is increased. So this is what we call the manic episode. The depressive, on the other end, these patients also, during the course of their illness, will develop depression. And we talk about depression, so no need to explain what depression is. Now, if a patient develops these manic symptoms for a period of 1 week, then we diagnose them with bipolar disorder. Now, bipolar disorder is different from schizophrenia because bipolar disorder is a disease of the mood. So the patient's mood either is too happy or they can be irritable, too touchy, too angry, and they easily get upset and irritated. Whereas the schizophrenia is disease of the thought. The thoughts are disturbed, and the patient will be having usually abnormal thoughts, abnormal beliefs, and also the abnormal perceptions that I talked about earlier. The treatment is completely different. For the schizophrenia, we give antipsychotics. For the bipolar disorder, we give mood stabilizers, which is, I will not talk about right now for the sake of time. But one final comment to you, Khalda, is that even psychiatrists sometimes have difficulty differentiating between bipolar disorder and schizophrenia. It's sometimes difficult, but as I mentioned earlier, basically schizophrenia is a disorder of the thoughts, and bipolar disorder or manic depressive disorder is a disorder of the mood, of the patient's mood.
Okay, we have a phone call from Zainab. Zainab, go ahead.
Hello. Hi, good evening.
Hello, Zainab.
I just came down from USA for depression treatment because they couldn't help me. I've been like many doctors, professional doctors there.
In USA?
Yeah.
Yes.
And I like to know if I have to take the medicine throughout my life.
Yes.
I do?
No, I'm saying yes. I'm not answering your question, but I was wondering if you have any other questions. So this is a question you are wondering about the duration of taking the medication.
Yeah, I had it last 4
duration
years.
of treatment. Okay.
I got it from living there in USA.
Okay. Any other questions, Zainab?
No, I like to know more about depression. How do I get treated?
Okay. Okay, Zainab. Well, you come from I'm a graduate of North America. I did my board of psychiatry in Canada, So, and it is similar to the American system. So, I don't know how long you spent there, Zainab, and how long you've been treated, but I would expect that you were treated in, one of the best countries in the world that, pay attention to psychiatric disorders. However, it doesn't mean that, there is no other treatment, and it doesn't mean that we can't treat you here. Of course, if you came to continue your treatment, then I didn't ask you if you are seeing someone right now, a psychiatrist, or you will be, because you will continue to consult with someone before you do anything on your own. I always, advise my patients is to consult with your doctor before changing, decreasing, stopping your medication. That's the thing that makes life difficult for some people. Regarding the antidepressant treatment, Zainab, or the duration of the treatment, I mentioned to Ahmed earlier that we say 6 months to 1 year, or maybe 1 to 2 years. Unfortunately, some people who have a strong family history of depression, or who have frequent depressive episodes, these patients see a psychiatrist, get treated, and after a period of remission, they are doing well. After a while, after a year or two, they will develop depressive symptoms again. They get treatment, and after a while, they stop treatment, and they get depressed again. People who fall in this category, unfortunately, they might need to continue on their medications for the rest of their life. Now, there isn't really a need for me to say unfortunately, because that's a fact of life. People who have hypertension, they need to take antihypertensive medications for the rest of their lives. People who have diabetes need to take, diabetic treatment for the rest of their life. And some proportion of patients who have depression need to take the medication for the rest of their life. And there is no harm in taking these medications. Like I mentioned earlier, these medications are safe. They have a limited side effect profile, and they are not addictive, so they don't add any problem to the patient, and there is no harm in taking them for the rest of your life, Zainab, if you need to.
Thank you, doctor. We have a phone call from Sandy. Sandy, go ahead.
Yes, I'd like to thank you for this program regarding depression and schizophrenia. And I'd like to ask the doctor 2 questions, please. First is, what are the causes of schizophrenia? And the second is, how to avoid depression, if depression can come to anybody. Can it come to anyone? Yes. And how to avoid it?
Okay.
I just have these 2 questions.
Okay, Sandy.
Thank you.
All right. Regarding the causes of schizophrenia, there are many theories that are put in the literature trying to find out about the cause of schizophrenia. Now, and unfortunately, these are all theories. The most strong evidence that we have about why people develop schizophrenia is genetic. If someone has a family member who is a schizophrenic on either side, on the father's side or on the mother's side, they are at increased risk of developing schizophrenia. So that's the strongest evidence we have from our research and studies. There are many other theories, but they all are theories and they don't hold any solid grounds at the moment. If someone's parents both have family history of schizophrenia, that makes the chances of a person developing schizophrenia is even higher. So this is regarding the causes of schizophrenia. Regarding your second question, Sandy, which I think Ahmed earlier asked me about, is how to avoid depression. Unfortunately, if depression comes, it comes. It can't be avoided. The best thing to do is how to deal with it when it comes. Because there is nothing anybody can do to avoid depression. Well, basically keeping healthy is the rule for everything. So if you are able to eat healthy and exercise and do your work with your household duties and have friends, have some interests, some hobbies. Keeping healthy is maybe the best thing that could stop depression from happening. But if depression happens, the thing is to recognize it early and then get early treatment and help for it.
Okay, so doctor, you mentioned something about also eating disorders that will happen to the patient.
Yes.
Then with those medication, this will stop him eating or less eating. It depends about situation. Any kind of food that you recommend that this patient will eat?
Eating disorders is one of the group of the disorders that we have in psychiatry. And there are two main ones. The first one is called anorexia nervosa and bulimia nervosa. And they affect females mostly. 90%, up to 95% of these patients are females. So we're not talking about people who eat too much or who have obesity. This is not eating disorder. It's completely different, and maybe it falls under the realm of nutrition. But eating disorders that fall under psychiatry are, like I said, anorexia nervosa. These are females who deprive themselves of food and maybe to this severe stage where they die. And bulimia nervosa is people or females who have disorganized or abnormal eating patterns in which they maybe eat too much and sometimes they will throw up what they eat. And so these are separate categories.
Okay, the reason I ask you this, Dr. Gholoum, how are you? Dr. Gholoum Saleh? Dr. Gholoum? We lost him, I think. The reason I ask you, I want to surprise, because our next week, Dr. Gholoum, he's a nutritionist.
Yes,
so
he will be able to talk about the
but unfortunately,
overeating or unhealthy eating patterns.
We lost him. Since you were talking about, immediately we brought Dr. Gholoum.
Yes.
Saleh Mandi. We have him, we're still, okay, they're still calling him like this. Because the problem is this overweight also people, they feel comfortable to do this.
Yeah.
They say, when I eat, I feel I'm okay, but also he's hurting himself.
Yes.
So how can I stop the triggering of the brain that is telling me do this, then will make you happy? So this is the problem.
Okay. How we can help these patients is with
because there is pleasure on eating. I mean, there is something that makes him to satisfy himself. That's why he's doing this.
Okay.
If there is no joy, he will not do it.
Okay, so you're talking about a behavior, an eating behavior, and
no, I'm talking. He's depressed. When he started eating, then he said, "I'm satisfied.
Okay.
I am." Okay. So there is a joy from this eating. How can I stop this person from doing this?
Okay, I thought you were talking about people who are not depressed.
No, they are depressed. They start eating to do this.
Okay, so there are, like I mentioned earlier, there are people who are depressed, and part of their depression comes with overeating, and they will gain weight. It's not a matter of stopping the trigger, because if it is part of their depression, if we treat the depression, this cycle will end of overeating and overweight. But if it is a behavioral part which has nothing to do with depression, then you need a behavioral approach, how to do some behavioral modification. It's like any other habit that a person cannot control or cannot stop. There is a behavioral approach to it. But if it is depression, then we treat the depression. We don't treat the eating disorder. We treat the depression. If it remains, then we will focus on it.
Because the eating disorder is a result of depression. That's why you have to